Good day, folks. Alfie Vente here once again of Vente Pain Relief Clinic and VPRC.ca. I am hoping you're having a great day. Today we have a mini class. We're going to talk about chronic pain and tightness of your fascia, the connective tissue, and how it may be important for you to use manipulations that require more pulling techniques versus pushing or rolling types of techniques. So as you can see here, this is a foam roller. Many of you have seen this. Many of you have used it. Many of you have basically used it to help relax your back. You've rolled your lower back, your hips, legs, whatever it might be. It's a great tool, especially if you are trying to maintain a certain level of muscle suppleness. But when it gets to a point, it can get to a point where the muscles are so tight and it's so tough that regardless of how much you roll, how much you foam roll, it won't relax. And this is where you have to take another step. You have to figure out other ways to help relax those tissues. It will happen over time, especially if, for example, you don't spend as much time rolling out your back, rolling out your hips. Maybe you're doing more exercise relative to the amount of rolling and stretching that you're doing. And when it becomes really tight again, it may be necessary for you to try to see if there's other techniques that might be helpful. So this is what this mini class is about. It's basically pulling techniques versus pushing and rolling techniques. And why, if you suffer from chronic pain and tightness, the pulling techniques may be more necessary, more required than, say, the pushing or the rolling type of techniques. So I'm gonna have a couple of videos here to demonstrate different techniques that therapists might use and show you a technique that can be more helpful than anything, particularly if you have chronic pain and tightness. So first, we're going to talk about the fascia. What is it? The fascia is the connective tissue that lies underneath your skin. It wraps around muscles, bones, organs, nerves, joints. It connects everything together. At times, the fascia can become very, very tight. It can cause spasms in an area. It can cause local symptoms, and it can cause symptoms potentially distally away from the area that's really, really tight. When the fascia becomes to a point that it's very tight, regardless of how much foam rolling you do, it may not even relax it. So you got to look at another avenue to get those tissues to relax. So there are many ways to manipulate the fascia. There are, as I mentioned, the pushing techniques and the rolling techniques and the pulling techniques. And I will show you on the video, on one of the videos here, starting with the pushing techniques. So I spoke about the foam roller to release tight tissues. These are 4 typical ways that a therapist may relax an area, a very tight area, whether it's the muscles or the fascia. So generally what a therapist may do, it's generally a massage therapist, but a chiropractor or a physiotherapist may also use these techniques. I'll demonstrate with this video here my fingers, my thumbs, and my elbow. And they're basically stationary techniques. I put pressure on an area, try to get that muscle to relax, a tissue around that area to hopefully relax and become less symptomatic. So you'll also see that with my elbow, I'm doing a stripping technique of the muscle to help relax it. These are 4, but there are a lot more techniques to use. But these are the 4 basic ones that generally therapists will use to help relax the tissues. But what happens if this doesn't work? If the therapist is digging in and it doesn't seem to be relaxing? Well, I'm here to tell you that as a massage therapist, my strategy is to go with the next video. So this next video is demonstrating a technique, a pulling technique. Remember the other techniques that I showed you in the other video were more pushing type of techniques. This is a pulling technique. It's called a skin roll. So this skin roll technique, as you can see in the video, is basically myself pulling on the tissues and rolling, pushing and rolling, trying to pry the tissues, the connective tissue underneath the skin away from the muscles or whatever is it's stuck to, because it can feel very, very stuck. As you see on the video, by the way, this is my significant other, my wife, Sandra. Thank you very much for helping me with this video. You'll see that by using these techniques on her back doesn't seem to be as tight. So generally speaking, I'm able to pull on the tissues of her back without much difficulty. But there are those that have fascia. The fascia is so tight that it's hard for me to pry and pull and get it to relax. But once I get it to relax, generally the muscles feel a lot better. The area becomes a lot looser. And it may take a bit of time for it to relax. This is a technique that I use, one of the main techniques I use to relax the tissues. Basically, what I do is I actually go after the fascia first before I go after the muscles, because what can happen is I can go work on the muscles, but the muscles won't relax until I relax the fascia. I have a saying, relax the fascia, the muscles will follow. Now, I can keep digging in for 20, 30 minutes on the back, but it may not go, it may not release. So this is my go-to thing. If I feel the fascia is very tight initially, I will work on the fascia first. Some therapists, they may use, maybe 5 or 10 minutes or whatever of fascial techniques. Myself, I've been known to do this for about 45 minutes to potentially close to an hour. My belief is that I believe so strongly in working with the fascia. I mean, I've seen results over the 20 years, the crazy, magnificent results, and they seem to be more long-standing. That's what I've found, with me as a clinician doing this for many years. The question is it painful? And the short answer is it can be very painful. Heck, it can hurt a lot. And this depends on how chronic the issue is, how chronic the area is, and how tight the tissues are. Mind you, though, if you're patient with it, you will find significant changes, particularly if it's related to how tight your fascia is, whatever symptoms you might have. So for me, because fascial techniques, working on the fascia is actually the base of my work, I'm very, very biased towards using these techniques. So, as a review, if you've been suffering for a long time from chronic pain and tightness and have found minimal changes from using pushing techniques or rolling techniques such as from the foam roller, it may be a good idea to change your mindset, change the avenue in terms of like how to release these muscles and the tissues by using more fascial techniques like the skin rolling technique that I mentioned. This is Alfie Vente once again of Vente Pain Relief Clinic and VPRC.ca. Please like, share, or subscribe to our social media. And if you know anyone that this may help, please share this. We always appreciate it. I want to thank you in advance. If you have any questions, please feel free to call us at 416-644-8894 or email us at admin@ventepainrelief.ca. Have yourself a great day. Until next time.